Alright, I'm gonna come in and close the curtain.
It's on picture.
Did you get a picture of me?
Hello, my name's Laura. I'm gonna be your nurse today.
Knock knock.
Can you tell me your name and
Hi
date of
there, my
birth?
name's Dylan. I'm gonna be a student nurse today. Can I get your name and date of birth?
Alright, awesome.
Okay.
Are
do
you
have any
allergic to
allergies that I need
anything?
know? And
Okay,
any-
no allergies.
Okay, Mr. Howard. So today what I have to do
Alright,
is
I'm gonna do a quick
suction
abdominal
off your
assessment on
airways
you.
because you have some secretions. That's why it's harder for you to breathe.
So I'm just gonna take a
So
quick look
first
at your
off,
stomach.
I would do a lung assessment.
Kind of
checking,
inspect it.
See front and back.
Okay.
How he's breathing.
I'm
And
gonna go ahead and auscultate.
let me get some gloves on. And the suctioning I'm going to put it at is 120 in MHGs, but I'm not actually going to turn on the machine. So, first off, place a blue pad just in case. Make sure the patient has an hemorrhage in the spacing.
Alright, everything sounds good.
And then now I have
So I'm gonna
to
go ahead and palpate.
set
Let
up
me
for
know if
my
you feel any
sterile technique,
tenderness.
because this is a sterile procedure. Perform hand hygiene.
Alright, no
ahead.
pain? Okay,
Open
perfect.
this.
So at this point, the doctor has put in an order for you to go ahead and receive a feeding via an NG tube. So I'm going to go ahead and place that. You might feel a little bit of discomfort, but if it ever feels like too much, then just let me know and we'll stop right away, okay? This is going to kind of protect your blanket. All right. Can you go ahead and breathe through your nose and tell me which nostril feels more patent? All right, the one on your left. Very good. All right. And then on a normal client, we would go ahead and use this to lubricate the first couple inches of the NG tube, but since this is a mannequin, we're not going to do that because it could cause problems. So what I am going to do is go ahead and measure.
So now since my hand did touch
From the
that, that would be
ear
a mess up on sterile technique.
and into the
And I would
nose,
have to
and then all the way
restart,
down to the
but for
xiphoid
this
process.
video, I'm not going to.
Now it looks like it's at about 50, so that's the mark we're going to aim for.
Okay. So now go ahead and open up my lube.
All right, so we're going to go ahead and begin inserting it. We're going to have the client swallow as this passes to help prevent gagging and kind of move this back and forth. Kind of roll it while we're inserting it.
Looks like it's 13.
And have him tilt his head forwards.
Now I will attach suction here.
All right, and now that we're at the 50 mark, we're going to go ahead and tape it.
And then I would slowly insert.
Make sure that it doesn't move around.
And now only on the way out would I start to occlude slowly.
All right,
twist
and then
while
at this point, we're going to go ahead and check for placement. We're going to do this, first of all, by aspirating a little bit of the gastric
And now if they
contents.
needed another pass, I would need to wait at least 30 seconds to a minute before the next one.
And then we're going to
You
use the
never
pH
do more than
test
3
strip to make
passes
sure
at
that
one time.
the pH is more acidic than 5.5, which would indicate that it is in the stomach.
Remove gloves. Perform hand hygiene. Put on your fresh gloves. And go ahead and clean up.
Okay, and then we're going to go ahead and just replace the gastric contents that we didn't use for that. And another way that would be really good to check placement would be to go ahead and get an x-ray, but obviously we can't do that right here in the lab. So now I'm going to demonstrate a couple different ways to do a tube feeding. The first one is through a syringe, and the way that we do that is we can go ahead and pull this right off, and then we would connect it here, and then we would just pour in however much of the feeding. For this order is 75 milliliters, so we could pour in 75 milliliters of the feeding solution, which we don't have here in the lab because it can't be used with the mannequins. And then just basically with gravity, the higher it is, the faster it's going to flow into our patient. And then the second way that you can do a tube feeding is to use a bag. So we go ahead and attach that just like the other. And then for that, you would just go ahead and open it up, pour in the contents, and then close it. And then you could hang it. And then in the hospital setting, you would be able to hook this up to a pump, just like an IV pump, that would more accurately control the rate. Once you are feeding your client, you're going to go ahead and want to come in and check at least every 4 hours to make sure that there is no residual volume and that the client is digesting the food that you're feeding him. Other than that, for right now, we're just going to check, make sure the patient is comfortable, remove our gloves, and that's all.